Hi, my name is Julia Kamnetsky.
She's good.
So I've been asked by Dr. Caruso to tell a little bit about my story. On November 9th, 2001, I had an accident at work. I worked at a hospital, and I basically hit a counter, a very hard counter in the kitchen with my teeth by being not very careful and skipping around. So I wound up avulsing the top 4 teeth of my mouth and creating hairline fractures on 3 bottom teeth, and also getting this nice scar here. I wound up getting 17 stitches for my scar, and initially they put the teeth back in, and I had root canals, and the teeth were capped. And then about probably 3, maybe 4 years later, I developed a root resorption on first on this tooth, and about a year or 2 later on this tooth. So I wound up getting implants, first on the first one and then on the second one. It turned out that the 2 implants wound up being a little too close to one another, and when I found out that the other 2 teeth also developed root resorption, the dentists that I was working with suggested that I consider taking the 2 initial implants out and either creating 4 separate implants or creating a bridge. So after everything was explained to me in great detail, with a lot of education by Dr. Caruso and Dr. Sisto, I decided that implants would be the better thing. So I proceeded with a set of different things. I had a bone graft from my tibia, and some special material was added to help my bones grow. And currently I have 3 implants. One of them didn't really take, and we're almost at the end of the procedure.
Today essentially is going to be a fun day, and I always say to the patient, because this is a culmination of many years that Julia has been waiting patiently for this prosthetic appliance. So today I'll be showing you impression taking from implants. I'll show you some unique and some advanced procedures to check the stability. Okay, so what I'm going to do is to take off the prostheses. I want you to, Julie, because she knows the combination. And now we have a graft that we took from the tibia. Left or right knee?
Right knee.
Right knee, and we took a bone. Dr. Sisto is the oral surgeon that I work with almost exclusively, and he did augmentation of the anterior maxilla. Augmentation with several ingredients, so to speak, for growth factors. One, we use the tibia, which is more of the medullary bone and less cortical bone. Then we use a product called BMP, bone morphogenetic protein. This is the state of the art in osteogenesis, and it is the only known subject that is what we call a recombinant genes in growth factors to enhance osteogenesis, meaning bone growth along with the gold standard of native bone or the patient's own bone. We incorporated also PRP, platelet-rich plasma, in that as a gelatinous mass or formula along with the BMP. The BMP also contains a collagen matrix that is derived from the Achilles tendon of a cow. Don't worry about that, okay? And that is the carrier upon which we use the BMP. That cocktail of BMP, PRP, autogenous bone, along with a titanium carrier to contain the graft, is the protocol and procedure that we did. The surgery was done under general anesthetic, taking Julia's healing abutments out. And I talked to Julia, this is not, she asked me if this is an invasive procedure. It is not. I always say this is a fun procedure. You have a little chlorhexidate, yeah, a hexadate for me. And what I'm doing here is, we're going to hold this here. Now we have the 3 implants with the augmented bone. And now what I'm going preparation were the implants. And note, I always like to talk about the transmucosal chimney. What does that mean? it means the implants, where the implants are placed, are approximately, say, 2 to 3 millimeters from the free margin of the gingival tissue. That is done for many reasons, mainly for aesthetics. You will not see the implant at all or the metal part showing. So now we have the implants placed, and you can see here. Now what I'm going to be doing is, this is a little magnetic probe. These are sterile probes. And I'm going to explain what this is about. Magnetic probe. And we'll start over on her left implant. And I'm just going to hand tighten them down, okay? Right. Now, Julia, would you just hold this like wood? We have oak, we have pine, we have balsam. And so literally, when a screw is placed into wood, you know how strong that wood is if it's a balsam wood. Now we see on Julia's case that implant is very secure and very stable. Now I'm going to take it from the mesial and distal. Correction, I took it from the mesial distal. I'm going to take it from the lingual. And it is 70 again, or 75?
70.
70. So we know that implant is extremely secure. And so what I'm going to be doing now is taking that little peg out, so that this graft material that she had, all of the surgery, the cocktail is the state of the art in terms of osteogenesis, meaning bone growth. So we have a very secure implant. And then we'll go ahead and we'll take it this way here. It is absolutely a superb patient. She may feel a little bit of the tissue. Is that correct, Julia? Mm-hmm. When I do this here. And you know, notice you hand tighten this. Okay, you don't want to strip the threads of this magnetic probe. I'll take it again from the buccal lingual. Why are we taking two measurements? One, don't forget the bone on the buccal lingual. The lingual may be very thin, however, not in Julia's case, but yet the bending action of an implant buccal lingual may be different from mesial distal. So we'll take a measurement from the lingual. What is that?
31.
Well, look, these are the surgical stents that we use in order to determine the proper trajectory of the implants themselves. There are different guides corresponding to the different diameters of the drill. I'm not going to try these in. The implants are in, but these are the guide that we literally, or I, along with Dr. Sisto, designed the implants from the computer from a medical grade CT scan. Okay, you chlorhexidine. Okay, this is going to be an open tray technique as opposed to a closed tray technique, and I'll show you the rationale. Luke appreciates that for the stability and the referencing of these implants. This is an open tray, and incidentally, these are Bihorizon implants 3.0. They're small, thin implants that we use pretty much exclusively in the anterior component, okay, for aesthetics. You certainly have good stability of these implants, and now we're going to go ahead and put each open tray impression. Now this is a hexagon in that area, so what I have to do is start the screw with this. Oops. Now what I have to do is actually get the feeling tactically as to when I'm engaging. When I'm engaging, you okay, Joyce? You feel a bit. Okay. So now what I'm doing is I engage the hex as I feel it into the opening of the implant. Now I'm going to be just using hand pressure here, right? Very stable. And so we have the impression coping open tray for the first one. Now Aida will give me the second one. Again, you know, the tissue really closes very fast as when we have either the healing cap out or when we are inserting the impression coping. So I'm going to try not to hurt Julia. Again, it's not engaging the hex yet, okay? part of the composite, and then wait until it's completed. Where's Luke? Is he here?
Yeah.
I need a little bit more.
More?
Right here, right here. Accentuate a little bit here and a little here. Yeah, here and here.
Okay.
I did, in order to make this transfer extremely accurate, I take dental floss. I prefer Glide, it's a little bit wider, to wrap it around the impression copings. But you notice I wrapped it around so I don't touch the screw hole, because this is where the composites are going to be where the dental floss is. And I don't want to encroach it on the screw when I unthread the screw. Now what I'm doing is taking a composite, a light care composite, to literally stabilize the dental floss. And at this point I want Ada to light cure it. I love the color of this here, Luke. Yeah. And it is far easier, Luke, to use. Notice I don't want to put it near the pontic.
Oh, I'm sorry.
Luke, I don't want to put it near the tissue because we want to get a good impression of that.
Yeah.
Do you see? I should stop it.
Yeah.
Let me put a little bit here so it looks pretty. Okay. We'll go ahead and start the first phase, okay? In other words, when I inject this light body, okay, around it. What I did in here is Julia's models with the 3 implant placed from the stereolithography. And what I'm doing there is so that so Luke could go ahead and make the custom tray for an open tray technique where the trajectory of the implants are free so that I could actually remove the tray. You'll see the impression in a few minutes. And the opening of the 4 implants are right in the area here. I always cover it with either a beading wax or a soft pliable wax so that when I when I put the impression in the mouth, I could feel the screws. Then I take this off and Ada will then get access to those screws to subsequently make this very easy to remove. And up here, look, okay?
Yeah.
She takes this off, and then she goes to take a little bit of the gauze. You see this? Now one is disappearing, so she's going to get that out. You see that, Luke?
Yep.
So, Ada, would you take, say, just took a centric relation record. We do 2, one in the anterior component, and in a little bit I'll be taking left and right posteriors, okay, for the orientation of the models. All right. You have it?
Thanks.
A wonderful patient here.